Hey guys, Michelle here with Lumina Massage. I hope you're having a great day. Previously on my channel, I made a video on C-section postpartum recovery, and today I want to talk about something a little bit different. So I have a pretty fair amount of experience taking care of moms, and postpartum includes that as well. So today I want to talk about 3 areas where I definitely see a pattern with most women. So whether you're a massage therapist and you're looking into taking care of moms for postpartum, or you're a mom that just gave birth and you're thinking to myself, yeah, this sounds this sounds about right. I really want to cover that and how massage therapy can help and what type of massage. So the first area that I want to cover is the neck, right? So we have the neck area here. So when you're breastfeeding, which is super common for postpartum, even if you're not breastfeeding, I notice this with a lot of moms, that there's a lot of looking down at baby, or you're holding baby and you're kind of looking down. If you're breastfeeding, you definitely feel that strain on your neck. There's something called the forward head posture, which is basically when your ear is not aligned to your shoulder area, and you're kind of doing this. A lot of people are guilty of it. What happens is that the weight of your head puts strain on your neck muscles here, and I see a lot in postpartum. So that's one area, the first area that I take care of. The second area is the shoulders, or the mid-back area. The reason I'm doing this is because it's between your shoulder blades. If you don't know what your shoulder blades are, they're like the flat bone that are kind of like your wings, if you will, like one here and one here. You have muscles in between the shoulder blades called your rhomboids. You have many more muscles, but the rhomboids are like the top. Those get really tight, and the rhomboids are responsible for helping you with a lot of arm movements. So again, if you're lifting baby up, or you're holding baby, or you're contorting your body in order to feed baby for many, many hours, that muscle tension will build up and it can become very, very painful. The third area is your lower back, but it's not necessarily the lower back muscles that you may think of. Yes, you have the spine, and you have the muscles lining up against the spine, and those for sure can get very, very tight. There's also a secret muscle called your QL. QL stands for quadratus lumborum, and it's actually not a lower back muscle at all. It's a deep abdominal muscle. So you guessed it, when you're hunching over, when you are picking baby up, you are making movements with your torso, and you're contracting because you're bending over and then you're coming up. As you're doing that, your lower back muscles are engaged. Again, the QL is not the only muscle, but it's kind of like a hidden muscle that a lot of postpartum clients of mine I see over and over again. But once we find it and release that muscle, it is a game changer, ladies. So the style of massage that I work with, and typically where I see the best results, is neuromuscular massage therapy. This is more clinical. You see it a lot in physical therapy centers or sports medicine. However, with postpartum, in these 3 top areas, this is where I see it the most. I do have moms that come in occasionally with like glute pain and pain in their hips. However, once they give birth, that lower back pain and those specific gluteal muscles just don't, I know this looks kind of weird, those specific gluteal muscles on the bum area is just not as prominent as it used to be. So assessing the muscles is really important for postpartum. But yeah, those are the top 3 muscles, and they get really, really tight and it can be very painful. But if you are a mom that just gave birth and you're experiencing pain in these areas, or you're just curious about how to get the most out of your postpartum massage, if you tackle these areas, the neck, the rhomboids, and the QL, just as the primary areas when you go in to get a massage postpartum, that would be wonderful. It can be a little bit intense, but I promise you, I have moms that come in that feel so much better, and this style of massage really, really works for that muscle tension and that pain. Alright guys, I hope this has helped. Please check out my video on C-section postpartum massage. That is a completely different topic, but it still is a very good video, and I hope that you get something out of it and that this video and that video serves you as well. If you have any questions about postpartum, feel free to leave it in the comments below. You can also check out my website, luminamassage.com, and send me an email if you would like, and or you can find me on Instagram and Facebook as well, and I'll be happy to answer your questions there. All right, guys, have a wonderful day, and to all those mamas out there that are just struggling with that back pain, please know that there is a solution for you. So please find a local massage therapist in your area that is willing to do this work, and you will feel so much better. Have a wonderful day, guys. Bye.